Greetings once again. It's a pleasure to be back. It's a pleasure to share as well. And I promised last week when I was talking about optimizing human resources for health, today I was going to look at reimagining pharmacy education and training with a focus on addressing emerging market needs and actual trends. So that at the end of the day, our training in pharmacy practice actually are in sync. We don't need to train people on skills that might not be relevant in the industry, but at the same time, we need to ensure that these are actually interlinked and are also responding to what the market needs at one particular point in moment in time. So for this, it's partly informed by the video that I did last week, the recording that I had done, and the other bit about what informed me to work on this particular slide and this particular presentation today is my undergraduate pharmacy education program. And that was to assess whether our pharmacy education curriculum was meeting the market needs and was it responsive to the market demands in terms of what are the trends, what are the current emerging areas of practice, and how then can we make it responsive to those needs. And also one of the key things that we need to acknowledge is that the pharmacy education and generally education and training across spectrum has evolved to the point that we know we have the deductive training, we have the technical skills that people need to acquire. But beyond that, there are other unconventional aspects of training and skill that we need. And these competencies would cover the 4Cs that we talk about: collaboration, critical thinking, communication, and creativity. So if we look at all those four aspects, are they being integrated in our curriculums? So on that particular note, then I'm going to look into this from one, what is the need for education and training in pharmacy? What are the conventional education and training of pharmacies? What does it entail? What has it been? And how do we move from the current standards? Then the next thing would be looking at what are the emerging trends and dynamics in the industry, and what do they mean for us into the future as professionals in the industry, as a young pharmacist, a young person getting into pharmacy education. How do you make the best of these, and how do you position yourself to be able to respond and actually be market ready for these emerging trends when they arise? Then finally, we need to look at it from what should we do? And what should we do and what we are going to do would be informed by the different areas from which we integrate and engage with the education and training of pharmacists, but at the same time looking at what are the key ingredients, the key components that are needed for us to champion and actually transform the future of our training and education of pharmacy in the country. So when you look at it from the need for education and training, luckily enough, I've just finished one of the books that I've been reading, and this is The Future of Capitalism by Paul Collier. We're looking at the new anxieties. When we talk about facing new anxieties, we know there's a great substantial divide among the educated and uneducated, with metropolis and the cosmopolitan cities. What are these driving factors? The level of education would be critical, but at the same time, we look at education as an equalizer. The question that we're seeing now is the highly skilled people whose skills are meeting the market demands are getting lucrative and well-paying jobs, but then others are not getting as much of those well-paying jobs. I'm not saying that is the same dynamic of what pharmacy is, but when you look at it from the need for education, is about skilling people, equipping them and giving them the skills and the competency they need from the technical background and understanding of the principles behind the practice to the actual skill to deliver on that particular work. And therefore, once we equip somebody with these skills, we expect that these skills would be equipped and actually suited for the job market to which they are going to practice. And therefore, if we look at it from a pharmacy background, then education and training of pharmacists is supposed to be able to equip a pharmacy student or a pharmacist undergrad going into postgraduate and all the advancement education, is to equip you with the skills and the knowledge to be able to make scientific judgments when taking care of a patient, if you're looking at it from a pharmaceutical care perspective, or to be able to apply your cognitive pharmaceutical knowledge in terms of medicines production, looking at regulatory affairs, quality assurance, patient safety and pharmacovigilance issues, whichever area of work you're practicing, whether it's a supply chain manager, you're a pharmacist, you need to be able to apply this knowledge you've gained in that practice. So the question is the education and training enabling you to be able to do that? And if it's not, then there would be a lapse. So that is the basic need for that education. Then once we see that as the need of the pharmacy education, then the other bit we need to ask ourselves, what is the current conventional education and training for pharmacists? What has it been? How has it been? And what are the trends? What do we see coming up? One key thing that is there is what we have to acknowledge is one, the training of pharmacy in Kenya started with the University of Nairobi. Over time, this has increased to the current moment where we have now 9 universities. Of these 9, we have University of Nairobi, we have Kenyatta University, Jomo Kenyatta University of Agriculture and Technology, we have Maseno University, we have Kisii University, now we have USIU, KEMU, MKU, KEMU and USIU and MKU. So those are there's 9 of them. And out of the 9 universities, on an annual basis, we are actually getting almost 500 graduates or so, between 300 to 500 every year being churned into the market as future prospective pharmacists. And with this conventional training, what we can know is the initial 2 years of practice is a 5-year program. The 2 years of training, you have the preclinical studies. From third year, fourth year, and fifth year is the clinical pharmacy training, where you do the pharmaceutics, pharmacology, and all the technical aspects on the pharmacy practice itself, which is good enough. But also this period is where you're now exposed to experiential learning, with major bit of it being domiciled within the core areas of practice for pharmacies. That is community pharmacy practice, hospital pharmacy practice, or the clinical pharmacy, if you may say, or the industrial pharmacy practice. Those 3 components of practice. But we all acknowledge that the training and the practice of pharmacy is going beyond these conventional lines of work. And that is why when you look at the kind of video that I've created in the previous times, I've talked about clinical research, I've talked about pharmacovigilance, regulatory affairs, project management, global health, pharmaceutical supply chain, and what is the role of digital solutions. And now we know there are great innovations and inventions that are coming up that are actually disrupting how we practice in the industry. And these are key things that we need to look into. So when we know those are the kind of training, we had majorly deductive training where we talk about lectures, theoretical knowledge, and gaining of those skills, math principles in class format. Beyond the deductive, we have experiential. Unfortunately, when you look at the dynamics and the current observations that we see in the market, there's not the experiential learning is there, yes, during the schooling from third year, fourth year, fifth year, but the amount of time given and the assessment criteria might not be making the cut in terms of how often do we engage with our patients, let's say, for a clinical practice? And if we do engage, are we following up on the clinical rotations that are happening, or are we gaining the learnings and actually making scientifically sound judgments on the kind of care and actually giving our opinions in terms of judgment? And that would be informed to a greater extent by also the practicing pharmacists under whose care we are being trained in that kind of settings as pharmacists. So those are some of the advances that are there. And I think those are key things that we need to look into. Then other than that conventional aspect, we're going to talk about that. After graduating, after the 5th year of education, you have 1-year internship that is paid by the government, and that is now under the Pharmacy and Poisons Board responsibility of the Ministry of Health. It's guided by the Pharmacy and Poison Board, Department of Pharmacy Practice and Training. And on that account, there are certain aspects that have been, there are reforms that have been there, which is good for us. And these reforms include the inclusion of a primary healthcare practice. And the primary healthcare component as an internship section is critical because from the Standard Declaration of 2018, we acknowledge that there's no universal healthcare coverage unless we go to the primary level where people exist in their communities, people operate from those communities. Are we able to make services accessible and available to them where they are? And are we able to actually structure this health system so that it's an interconnected one where people get value out of the care that they need? If that is able to be realized, then we'll be able to deliver on our universal healthcare aspirations. And therefore, the primary healthcare component, which has been integrated as a 2-month rotation, is a good addition. The question is, as pharmacy interns who are practicing, are we adopting this and are we practicing it to the level we need to? If you're in a primary healthcare facility, you need to ask yourself, what touch points do I have? What circles of influence do I have that I can apply my pharmaceutical training knowledge, project management knowledge, and the leadership skills that I have to be able to offer a solution to the community? And these, I'm going to refer you to the first video that I did this year. It's, I think that's the 3rd or 4th video that is in this YouTube channel. If you look at it, you'll see there's so much that you can do. Look at it from the HIV/AIDS clinic, the CCs, comprehensive care clinics. Beyond that, you go to gender-based violence clinics. We have neonatal clinics, the vaccination, child immunization programs. You have community outreach programs with community health workers. Can you train them? Can you engage with them? So if you look at all those different areas of touch points that you can engage in, you need to ask yourself, where are you positioning yourself and how are you positioning yourself to apply your preferential, actually advantage knowledge that you have and skills to impact the lives of people and to position yourself as an expert in that area. Those will be critical for you. And I think that is an area that we need to be keen on and need to explore as pharmacists in practice. So when we look at all that conventional industrial pharmacies here, there, yes, but most of it in terms of uptake for graduates, it's not been that substantial. And therefore, most of our pharmacies are not getting into industrial pharmacy because of limited capacity in terms of local manufacturing. But then we've seen advances after COVID and even now, as we're moving forward, there's a growing surge in local manufacturing and growing advocacy. And therefore, that is going to be a lucrative area. And also another thing we have to see is, as much as training needs to respond to the market needs, we also need to advocate for opening of opportunities in these areas. If a pharmaceutical company has only one pharmacist managing as a company pharmacist because it's a legal requirement, you need to ask yourself, how does this pharmaceutical company coordinate their pharmacovigilance aspects? How do they do regulatory affairs work? Who is doing the production as a company pharmacist assessing the quality? Who is at the quality assurance? Who is at the quality control? So these are the different technical, actually, these are key milestone areas in pharmaceutical production where we need a qualified pharmacist to be able to offer oversight and actually take responsibility in ensuring we meet the quality standard so that we safeguard the health and safety of our patients. So those are areas that we need to look at. So beyond that conventional understanding of what pharmacy education entails, then we need to ask ourselves, what are the emerging trends? Emerging trends is that, one, after 2017 protracted doctor strike, automatic posting came to an end. And therefore, that is the greatest disruptor that we had in the local Kenyan market. Because initially you'd be assured of a job posting by the government, which has now gone, and now you have to find a way to get a job after the internship. So with that, that is the dynamic. Where are you going to get your job? Where are you going to apply for these jobs? We have to be robust and actually critical on what, where do we want to get the jobs? Which kind of jobs are we looking for? How fulfilling are they? And how are we able to actually contribute to such kind of an ecosystem? And I think that will be a new area that we need to be keen on. Then another thing that we have to acknowledge is, over time, pharmacy practice at the initial phase, we started from compounding, apothecaries and all that. Then from the compounding of medicines, we moved to the point where we are now facilitating the pharmaceutical supply chain management. That became our all major focus of care, product management, the pharmaceutical products. Now with product management getting even, some of it is being digitized and all that, there's more need for us to offer pharmaceutical care. And when we talk about pharmaceutical care, is where you interface with the patient and deliver solutions that are impacting them and giving them value. Beyond just because automation is taking up some of the core product-oriented services, it's also because we've seen that substantial harm occurs to patients because of irrational or uncoordinated use of medicines. And therefore, we need medicines expertise in ensuring that patients derive optimal maximum value from the use of their medicines, reduce the potential harm and side effects that might arise from use of these medicines. If we actually interlink these different aspects, the benefits and the challenges that we are getting to face, then we ask ourselves, how do we position ourselves into this spectrum and deliver to that ultimate vision that what we want? So that is pharmaceutical care. Beyond that, we now need to see from all the other emerging advocacy issues. We're talking about the 6 health system pillars by WHO. We have human resources for health. We have technology, supply chain of medicines and all that, service delivery, leadership and governance, health information management system. So all those six factors, where do you position yourself as a pharmacist? And these are coming with emerging trends, because when we look at healthcare financing, there are financial institutions which are looking at investing in the pharmaceutical value chain. As a pharmacist, you understand the pharmaceutical value chain, you're better able to advise on how to design pharmaceutical financing solutions and investments for packages. Are you going to venture into such spaces? These are emerging trends. Technology companies are coming into the pharma industry. If you see the kind of investment Amazon is bringing in, we have so many companies, Microsoft as well. So these big companies are coming into the pharmaceutical industry. But at the same time, for them to hack the industry, they need the local experts. And the local experts, in my perspective, would be you as pharmacists to be able to tap into this. Me and you, we can drive that agenda by giving the technical background and relying on their own technological advancements and capabilities. Then we deliver a solution that is fit for the market and actually able to be sustained long term. So these are some of the emerging trends. Global health conversations have been there and they're still ongoing. How do we position ourselves to manage even, let's say, distribution of particular pharmaceutical products or self-care products? You have to ask yourself, where do I get into that? I talked about menstrual hygiene management in one of the previous videos. You can look it up. Where do you position yourself? And these advances are coming up. And if they're coming up, then we need to be positioned. And it has to be integrated into our training curriculums to ensure that we are able to know what are the opportunities, what are the possibilities that lie ahead of us. And I think for that, then we need to make advances, and these advances need to be very robust in terms of meeting what the market really needs. Then when do we do then? knowing that the training is critical for us. We understand the conventional training, and we've seen the emerging trends and the emerging dynamics of the industry. The question is, what do we do? What we need to do in terms of our training as a practicing professional. I'm in the industry, I'm in touch with what's happening in different areas, especially those areas where I interface with the industry. And therefore, I'm able to share my insights and these wisdoms with other young pharmacists and even with the academic faculty to ensure that they're informing their training, they're informing the review of their curriculum to make it responsive. We don't need to work with a curriculum that was designed in the 1980s. If we are now in 2022, that could be obsolete already. So why don't we change such? So I think as a practicing professional and other practicing pharmacists, it is our responsibility to be critical about engaging with the different universities. Let us inform them. Let us engage with the Pharmacy and Food Poisons Board from the practice and training department to ensure that we review the curriculum from a pharmacy and regulator perspective and ensure these curriculum can be cascaded among the different schools so that they are able to deliver quality, optimal training that is responsive to the market needs. That is our responsibility. From professional societies and associations, these are the umbrella associations that hold us all together. I look at the kind of work that I'm often engaged in with the FIP, International Pharmaceutical Federation, and we are drawing on expertise of different professionals in the industry. We do case handbooks, we do different key documents and all that. And these publications, they're not particular to particularly region, yes, but they're giving insight on what possibilities lie in the industry, what potential is within us. How do we take advantage of these advances and these best practices to domicile them as our core areas of practice and even open up new practicing areas, fields of practice. And if we can open these fields of practice, I think we can take advantage. And that would be my challenge to professional societies. For example, Kenya Pharmaceutical Society of Kenya, Kenya Pharmaceutical Association. When we have these associations, can they take advantage of them going the domains where their members are working, take advantage of these, bring them together. Let us do documents. When we come up with handbooks, we're able to share these, we'll be able to transform our practice. That would be key for us. Then once we're done from professional societies, then we now have to advocate for these to be adopted and to be mainstream in terms of even employment opportunities. If I talk about pharmacists in the pharmaceutical industry, and there are no jobs, then the training will not serve its purpose, because I'm supposed to train someone to be able to deliver services in a setting that they're going to be employed. So that is the professional societies need to do advocacy, and they need to take lead in terms of shaping that future in terms of practice. Then we have pharmacy students. As a student, you're the person being molded into the profession that you desire to be. We need to be thirsty for knowledge. We need to be curious enough to be able to seek for as much knowledge as we can and to ask ourselves, where do I want to apply this knowledge? How do I want to apply it? If you're able to, that would be your game changer. That would be the differentiator between you and every other pharmacist and every other person in the industry, because you are going for extra knowledge that is going to make you responsive to the market needs and more suited to deal with the market dynamics as they come. But we're not in a static environment. That would be critical. And that is my key challenge and key ask on pharmacy students. Be open to new dynamics. Don't be cocooned to the conventional ways of doing things. Things are changing. And as they're changing, try new things. You have the opportunity to ask, engage with senior professionals, and take advantage of these learning opportunities to ensure you are able to thrive at it. Then finally, regulatory authorities. There is the Pharmacy and Poisons Board and the Commission of University Education. From a regulator standpoint, you interface with every sector of pharmacy practice. Therefore, you are able to know what happens. Are you informing your training? Are you bringing stakeholders together to have key technical working groups, steering committees that would inform training, curriculum reviews, practice trends, so that we acknowledge professionalism, but also enforce it and foster it within the industry? If that is going to happen, that would be a win. Commission of University Education collaborating with the Pharmacy and Poisons Board can ensure our training is robust and our training meets the desired needs of what the industry should look like. And I think those were some of the key things that we need to capture. And finally, the training faculty. There's no way I would train as a clinical pharmacist. I'm not practicing as a clinical pharmacist. We need to have practicing professionals taking part as faculty, or the faculty having clinical practice, or even having practice engagements. So that is where the collaboration between the industry and the academic faculties need to come in, so that if I'm going to train in that pharmaceutical manufacturing, then I need to have access to a training facility or a production facility so that my students have an experience of what does it entail to coordinate pharmaceutical manufacturing of a particular product. It could start from initial receipt of the active pharmaceutical ingredients, as analysis and all that, to the end where the product is getting to the market, at the point of dispatch to the market. So if we can do all that kind of engagement and have students being trained by people working in the industry who are in touch with what the dynamics are, that would be a good thing. And on that account, then my challenge would be, can we have this kind of caucuses where we engage, we share experiences, we share best practices, and continue the conversation so that we shape the future of pharmacy practice. If you're able to, I think we'll have a better profession moving forward. So with that, thank you so much for following. Thank you so much for engaging. I'll urge you to subscribe to the channel. Let's engage, let's share, let's keep moving the profession forward. Thank you so much. Until next Sunday.